Hi guys, it's Dr. Gillard. Here is the screencast I promised on the review of the anatomy gross 2 section with regard to radiology. Now remember, none of this material will be on the actual lab final, but all of the extra credit questions will come from this PowerPoint. So here we go. Now, a couple of nice resources here. The free resource online radiology masterclass from the UK is a wonderful resource. This tutorial right here is awesome. I would check that out when you get closer to having these real core. Actually, I would do this before you get into the classes. Radiology is very important. You're going to use this for the rest of your chiropractic lives, so good stuff here. Here's our Chancellor's book, which is required book here for our radiology classes. It's a very good book. Here's another one that I like by Weir, Imaging Atlas of Human Anatomy, 4th edition. It's got some fantastic images in it. Good book. Plus, it's an ebook. You can download it for your iPhone, iPad, which I really like. I don't like hauling those big books around. And here's another great one, Hearing Learning Radiology, Recognizing the Basics. This is a great book to start. Again, you can get it online. I have it on my iPad and iPhone, and it's a really good book. Very popular in medical colleges these days, and if you go to Amazon, you'll see how popular it is. One of the most frequently bought books, so good book to have. All right, we're going to start with the thoracic spine today. This is obviously the thoracic spine, and this is a not a chest film, but this is just a regular hard tissue type of a film. This is obviously the back, this is the front over here, and this is the thoracic spine. Notice the normal thoracic kyphotic curve here. What's this line coming across like this? Hopefully you can see my pointer. This is the scapula. That's one of the borders of the scapula. We'll look at that board in a second. Let's zoom in though. More importantly, we want to know what this block of bone is here. This is obviously the vertebral body of T8. So if I have any kind of a marking on that, vertebral body, you don't have to say what level it is, but just say thoracic vertebrae vertebral body will be enough. Now the disc space, we can't see the disc, but we can see this region right here. So this is the disc space where the disc would be. So if there's a marker in here, disc space, thoracic spine. Here's the neuroforamen. Which one is this? Is this the right or the left? You can see it here as well. This is of course where the exiting nerve roots leave the spine, turn into the spinal nerves. Well, you can't tell if it's the right or the left. Remember I said at the midterm, X-ray is like having a steamroller squish your body into one image. It's not like a CAT scan where you see multiple slices. So everything's superimposed. So this is the right and the left neural foramen, or IVF, or intervertebral foramen. So what's this thing coming across? Now you got to start to look a little bit harder. But this is the lateral rib coming across. Lateral rib. Now, facet joint, if you look here, this would be T9 vertebral body right here. I'm going to use, well, I could use T8 as well. Here's T8. And here is the superior articular facet of T8. And it's meeting the inferior or inferior superior articular process, which is one half of the facet. Here's the inferior articular process of T7. So together they make the facet joint right here. So if you see something like this, just say thoracic spine, facet. Why would you have to see thoracic spine? How come it's not lumbar or cervical spine? Well, because you can see the ribs, right? You can see all these ribs coming across, so you have to say thoracic spine to get the point. And there's no half points with extra credit. It's either you got them or you don't. Now here's an A to P view of the thoracic spine. Again, does this patient have a scoliosis? He's a little curved, right? Actually, this is a normal part. It's a tiny, tiny scoliosis because of the heart right here. Why does his heart look so big? They're typically magnified in non-chest films. We're going to look at chest films a lot here in a second. Plus, he did not have full inspiration. This is an expiration, so it makes it look kind of weird like this. So let's review from the PA view. Let's review the vertebrae parts. Here's half of a facet, superior articular process with the facet joint right there. That's half of it. This is the spinous process. All of this, remember, the spinous process does make up part of the vertebral canal. This part here is the lamina. The smooth part, actually, where the T7, T8, and T9 are, is the lamina. Now remember, we have the ribs coming in, and there's two joints formed for the ribs as well. They're true diarthroidal joints. So we have a costotransverse joint right here, where it connects with the transverse process, and where it attaches to the body, that's the costovertebral joint. So this picture is fair game as well. Okay, here's a little Photoshop work I did. Just sometimes it gets a little hard. The vertebral body's in red. Spinous processes, you got to hallucinate them in there a little bit. You got to really look hard for them. Look like a nose, but there's one right there. And the pedicles are right here. What the heck are these things? Why do they look like that? Well, remember, this is the most dense region of bone, so they show up pretty thick. And they're very important. Metastatic carcinoma, especially breast cancer, likes to eat these away. Osteoid osteoma is a non-cancerous tumor, usually, that can make this look really white, and you'll learn about that, but these are important to be able to see the pedicles. You can see them here and here as well. There's the disc space again, right here. Here's a transverse process, a little bit harder to see, transverse process. Then you have the rib coming around, and this upper portion is the rib here. Pretty straightforward stuff. Here's a naked picture. You can't really see the spinous very good here. You can see it right here. Okay. Through a scapular view in here, just to refresh your memories, you should know these parts since they connect to the chest, I think. Here's the clavicle, right? Humeral head here. This would be the anatomical neck here. Surgical neck would be here. What's this thing right here? This big bump. Coronoid process. What's this line right here? That's the spine of the scapula. And what's this right here? Acromion process. The acromioclavicular joint is right here, where the clavicle meets the acromion process. And then we can see chest. So this is all the parenchyma of lung tissue. You can see the ribs quite nicely. And you can see the first rib coming around like that. This is that first link I put on the PowerPoint slide, is an example of one of their tutorials, and they're actually very, very nice. They're shaded and everything. Fantastic job. There's those parts in case you forgot them. Okay, now we'll spend the rest of the time on chest. We're not going to go into the abdomen. This PowerPoint's already 35 slides long, which is longer than I wanted to make it, but here's a chest film, and this is the nemesis of all chiropractic students, I think. It's hard to see things, but it's actually a very, very important film. You can detect all sorts of things from lung tumors, pancreas tumors, effusions, pneumonia, atelectasis, pneumothorax. It's a very, very informative film. Let's see, standard radiographs for chest-related complaints include an A to P, or actually not an A to P, it's a posterior to anterior. We do these backwards, posterior to anterior film and a lateral film. These are standard. There's some accessory views that you will learn about in oblique. Lateral decubitus, apical lordotic is particularly good for looking at the apices of the lungs up here. So you'll learn more about that though. Here's how it's taken, what you learn how to do. It's not taken looking at the x-ray tube, it's taken away from it. You spread your scapula out of the way, and then you get a beautiful image like this. And here's the x-ray beam would be going. That's the same picture. You can see how the heart is situated with right ventricle. Left ventricle will be way to the left side. There's a sternum right there. And here's the setup for the lateral view. We won't go over the lateral today. You can't glean quite as much information from the lateral as you can the A to P, I don't think. You can see the heart here, obviously, and the hilus be here, but main bronchi here. It's one of them. But we're going to focus on the A to P. Here's a normal A to P chest film. Let's look at some parts here. This is obviously the heart, right? You can see here's the left side over here. You see the clavicles coming across here. And this part right here, again, I hope my pointer is showing up here. This would be what? What part of the heart? That's the left border or left margin of the heart. So this is all left ventricle right here. And this part right here, no, not the right ventricle. This is actually more the base of the heart. This is the border of the right atrium, right here, right atrium. This is the hilus region right here, the hilus, where a lot of the big vessels come in. You can actually see right here and here, these are the pulmonary arteries here and here, and this is actually a piece of the inside the lung. This is the inferior, one of the branches of the pulmonary arteries here. This is the Meganblas or gastric air bubble, which is air in the what part of the stomach? The fundus. It's actually superimposed with a little. This patient has a lot of gas in the splenic flexure. We'll see a better one in a minute. This is important here. If you follow the lung down, you see the lateral part of the rib cage here, and it comes to a nice angle here. So this is the costal phrenic angle. Very important because these need to be clear and open. Here's the other one. If the patient has pneumonia or they're bleeding, any type of fluid, when you stand them upright, and these chest films are always taken standing, this will fill up with fluid, kind of like the pouch of Douglas. It's a very good indicator that serious things are going on. So always make sure you check these caustic phrenic angles. The ribs you can obviously see, but if I stick a tag on this rib, I want you to tell me not only it's the rib, and you can actually count these ribs. Here's 1, here's 2, here's 3. So this is the T3 rib. But the question is it the anterior or the posterior rib? This is actually the posterior ribs are the ones that you can see better. The anterior ribs you can see, like rib 1 here or rib 2, you can see it curling around underneath, and all of a sudden it kind of disappears. Why would it disappear here? Well, because it's costal cartilage here. It's not ribs, so you don't see the anterior ribs. Is much harder to actually see. You can also see this. If I have a little tag here, I'll show you in a minute what it'll look like. But this is you can call this the right hemidiaphragm, or the dome of the right diaphragm. This would be the dome of the left diaphragm. All right, here's another one. Now, this patient might actually have a what? Although this is not made to see the spine that good, these type of films. They're shot with different factors. They do have a little scoliosis. This is more than a physiological scoliosis here, but it's still pretty minor. This is a beautiful chest film. Whoops, I better put it back. This is a beautiful chest film. Let's go over some more parts. So this region up here of the lung, you see the bones, like if I put a tag right here, that's the apices of the right lung, or the apex of the right lung. Pancreas tumors love to grow in here, can compress the superior sympathetic ganglia or celiac ganglia. They can cause Horner syndrome. So always check the apices of the lungs when you're reviewing these. You can see how beautiful this image is. You can see the parenchyma of the lung tissue really nicely between the ribs. Now you can see the heart again. What part of the heart did we say this was? The left margin or the left border of the heart. anatomists call it the margin, the radiologists call it the border. So you can see it quite nicely there. What about this line coming down here? It's the medial border of the scapula. And right here, it's the angle of the scapula. You can see the scapula is back in play. What's this? Coracoid process. Now, what's this right here? That's called the aortic knob, which is the aortic arch. The aortic arch will go into the descending aorta here. And now we have another shadow right here. That's the pulmonary trunk. So if arrows are pointing right to here, pulmonary trunk. But if arrows are pointing here, you say aortic arch. What happened to the right atrium? Where's the border for the right atrium? Is it gone? Does he not have one? No, because of his scoliosis, it's blocking it so you can't see it. So this right here is a pulmonary artery. The other one is right here, a little bit harder to see. And that's the inferior branch of it. That's inside the lung tissue. You can see that kind of, it looks like a little artery going down. You can see the costodiaphragmatic recess very nicely right here. That's real easy. Again, real important structure. Hemidiaphragm is here. Okay, what are these things right here? See another shadow coming around. One's here too. Those are the breast shadows. So this is obviously a female. And let's see, what else can I show you. First rib again coming around. Anterior part is here. Is this a rib right here? No, that's the clavicle. Okay, second rib would be coming around like this. Third rib is a little harder. It's superimposed on the clavicle, but there's the third rib. Okay, so again, if I put a sticker right here, is this posterior, lateral, or anterior rib? Again, that's posterior. The posterior are always more transverse, more horizontal. This part here would be the anterior part of rib number 2 if I put a sticker there. And what was this again? It's gastric air bubble, or the meganblas. And I think that's about enough. Let's see if I forgot anything. Here's a zoom in view. Won't go over that. We just did that pretty much. You can practice. Here's everything labeled. I think I got everything. Trachea. Oh, I forgot the trachea. Let's take a look at that. That's important, right? You can see tumors of the trachea here. So it's right superimposed over the vertebral bodies, but you can see this dark area here. More radiolucent, it's called. And there's a bifurcation here into the right and left primary bronchi, which you can't see very good. I won't tag that unless I can find a better picture for it. But alrighty, what was that? That should be artery, of course, not ritery. Aortic knob. Okay. There's a picture of the lower region. I think we went over everything here. Looks good. There's the whole ball of wax. Okay, I think that's probably enough for you. I want you to go through this one by yourself. This is a little bit more complicated, but we've covered most of these structures, but you'll see there's a few more of them that we haven't, so you might see this again. And I think that will do it, so good luck on your final. Oh, let me show you one more thing. We're not done yet, sorry. So here's normal. Here's the right hilus region, left hilus region in general, right ventricle. Aortic knob you can't see very good. A nice left side of the heart there. There's the left ventricle. Okay, normal. I won't go into the ratios, but just kind of get an idea. This is how big the heart should look in relationship to the chest, the pleural cavity. See the trachea real nice here. Now look at this one. So what, and this is actually a beautiful example. What is going on here? Although it could have been taken with a little bigger inspiration. This is not normal. This is marked left ventricular hypertrophy. So this can be caused from the left side of the heart is the power side, right? If the patient has, let's say, PAD, peripheral artery disease, where the arteries are really, really constricted, so it's really hard for the heart to pump blood, it has to work much harder. Just like any muscle that a bodybuilder works in the gym, the heart can get big, so the left side of the left ventricle gets really big, and this, of course, can be dangerous because it can constrict the blood vessels to the heart itself. But this is an example. Make sure you know this. This is left ventricular hypertrophy. So if you see this out there in the test, left ventricular hypertrophy. Okay, what's going on here? This is a child and came into the ER. We won't talk about the atelectasis. I want you to just look at ribs. Okay, let's look really carefully. Let's follow this rib first. When we look for fractures, we look for breaks in the cortex in the outside. That one's okay, but look at this one. It's a nice example. Maybe on my Camtasia I can blow this up for you. But there's a fracture, fresh fractures right through here. So this is actually it was a child abuse case, unfortunately. Okay, let's look over the whole lung. There might be more stuff. Hint, hint. There's the arrows. So what's going on here? Look at this rib. Look at these big balls. Are those tumors? What are those things? No, those are calluses. Remember, when a bone heals, part of the healing process is callus formation. So these are older fractures. So this poor child has really been abused. He's got new fractures here. He's got old fractures here. Now let's test your skill. I said we won't worry about the lung collapse, atelectasis, which might be going on. Look at the ribs. Are we done with the ribs? Do you see anything? Or are we good? Am I fooling you again? There's some more serious fractures. There's actually 5 of them that you're probably missing right now, and I know you're going, where are they? Where are they? They're right here on the lateral border. Look at this, severe fractures. And they're not aligned either, so this poor child, this is just terrible. So they were just squeezed, and who knows what happened, but can you see how they're not meeting? Look on this side, you can see them, the normal. See how that angle that should come around the lateral part of the rib should be all intact. This one looks fine here, but this one is completely, it's actually subluxated, or luxated, or dislocated, you could even say. So, not good. Have to report that to the police if this is one of your patients, right? Here's another beautiful chest film here. You should know what all those parts are. Okay, well, good luck on your final. I hope this helps, and hopefully I won't see you gross 2 people next quarter, but I will see you around in the upper quarters.